Even though La Crosse Aquinas graduate Garrett Giroux and La Crosse Central grad Johnny Brevik are the same age, had many of the same interests, and ran around in the same circles, they spent the majority of their young lives totally unaware of the other, until their lives were both impacted by the same disease. Garrett's diagnosis came first.
I was a junior in college, 2005, fall 2005, when I was playing football. I discovered a lump under my arm that I thought was just aggravation from lifting and being an athlete, and ended up not being what I thought it was, and ended up being stage 3 Hodgkin's lymphoma.
In 2008, Johnny got his own devastating news.
I was 23. I had just graduated from college, so it was the prime of my life. I was so excited to get started. Had just finished up 4 years at UW Stout, and I knew something wasn't right, but I thought, I haven't been drinking a lot of fluids, maybe something like that. So I went into the ER at Gunderson, and doctor came in and said, "You have leukemia. We think you have leukemia." And I said, "I think you have the wrong room. I'm dehydrated."
And while they faced their battles at different times, it was very much a parallel version of emotions and experiences.
When you hear the word cancer, every other word that comes out of the doctor's mouth or anybody that told you at that point, it just goes mute. It's kind of a little bit of a blur after that. You kind of meet in a conference room that feels like you're having that meeting that you don't want to be having with medical professionals. I
said, "Okay, so when do I come back?" And he said, "You're not going anywhere."
I was invincible.
I immediately thought, well, this is curable, right?
I never thought cancer itself was going to ultimately be the end of me.
You know, being 23 years old, you're not prepared. You're not even thinking about dying. It's not even remotely a factor that you even considered.
So many similarities, and one more that would ultimately lead to their two paths crossing. Even though they were both in their 20s, their treatment protocol landed them in the pediatric oncology department and into the hands of longtime Gunderson doctor Bob Ettinger.
I'm the last doctor that anybody wants to go to.
I was the oldest being seen in pediatric oncology.
There's clear data in some disease categories, leukemia, acute lymphocytic leukemia being one of them, that young adult patients treated on pediatric protocols do better.
Better outcomes, but with it, a big frustration.
I really didn't have too many people to talk to at all that were my age that had been through a similar diagnosis. There are a lot of kids around.
You'd be surrounded by 8-year-olds or 4-year-olds or maybe even 12-year-olds, but nobody else his age.
I really wanted to speak to someone that had been through something close and get that kind of feedback, and I wasn't able to attain that really easily.
And that's how it happened, how an amazing endeavor was born. Garrett made his desire for a mentorship program known to Dr. Ettinger.
We had a number of programs already in place for other age groups, but not his. So I was all on board.
Garrett got the ball rolling for a program he would later name A Bump in the Road.
I just didn't want someone else to be in my shoes exactly from an emotional standpoint. Being able to say, if I could do this over again, here would be my suggestion, was a really nice step that we took from there.
And so, when Johnny Brevik walked through these doors a few years later with the same concerns and worries Garrett once had,
You just want to know, you want to be assured right away that you can beat this.
Dr. Ettinger knew the first mentor in Garrett's program should be Garrett himself.
He came up to me and goes, "I got a guy for you to meet. You're the same age. He's a lot like you," is what the oncologist kept saying. And he shares in the same wanting to help or make the experience better for others after he's done.
We had a great friendship that developed over kind of my last year of treatment, and knew that we were driving towards doing something.
After meeting Johnny when he started his diagnosis and watching him go through a multi-year battle with cancer, Johnny was the perfect partner for me to get involved and to take this thing to the next level.
And take it to the next level, they did. In 2008, Johnny Brevik knew if he survived his battle with leukemia, he wanted to do more with his life.
I remember laying in the hospital bed on my first night there and thinking, okay, John, if this is your last night, are you okay with how you lived your first 23 years? And I remember thinking, nope, I'm not good with where I'm at, and if this was it, I would be supremely disappointed with how I spent 23 years.
Years earlier, Garrett Giroux experienced his own cancer battle and also felt driven to do more, maybe help the next young adult in a department full of kids.
I was the oldest being seen in pediatric oncology. I really didn't have too many people to talk to at all that were my age. That's kind of where the idea came for creating this program for people in the lacrosse community to be able to have an outreach to work through start to finish with a diagnosis.
Their introduction came thanks to pediatric oncologist Dr. Bob Ettinger.
They're both young leaders in this community, and they both, based on their experience, want very much to give back. And so it was almost inevitable that they would meet.
But no one, not even Johnny or Garrett, could have predicted where this new partnership would lead. Before their initial meeting, Garrett had received a $5,000 grant from the Gunderson Medical Foundation, and from that, a bump in the road was born, a support group and mentorship program for young adults impacted by cancer.
The initial money that we got from the grant, that was meant to go out and as young adults get together, whether it was over lunch or breakfast or whatever, that money would be there just to pay for the getting together event so that there wasn't a financial burden or worry.
Events like this one at Shenanigans, where you can surround yourself with people who just get it, and suddenly the unknown is a little easier to face.
Perfect.
It's something really special. We all have this special connection, and we're kind of like brothers and sisters. We're not, it's past the friendship.
These are some of the most amazing individuals you'll meet. Everyone has like a different outlook on life, and no one takes a second for granted.
But the mentorship program was only the beginning. Johnny got an idea for something even bigger.
I had a great job, I had great health insurance, great family to take care of me. Didn't need all the financial help that everyone was offering, and the food and the different things to keep me busy, although the Sudoku books were appreciated. I didn't need all that stuff, and so as we came to the conclusion of my treatment, I had always told people, we'll do something for a good cause.
Then we started working on this party idea with Johnny that was kind of his celebration of beating cancer that was called Hope Lives Here.
Pick whatever theme you want, bring whatever silverware you want, make your people dress up, do whatever you want. We thought that would just be kind of fun. And as the years have gone by with this event, it's gotten much more elaborate and extravagant.
The event was a huge success.
We almost hit $60,000 in fundraising that first year.
So the next challenge, what to do with all that money? The answer landed them back to where Johnny and Garrett first met, the pediatric oncology department at Gunderson that already had the perfect place for younger kids.
But we wanted to do something neat in an area that was going to work for teens, for young adults.
It was dark. It was dingy. It wasn't very inviting or comforting.
Garrett and I worked very closely with some project managers and construction engineers at Gunderson to plan out a renovation of the whole treatment area in the children's cancer area.
Everything down to the fabric on the...
Yeah, we went chair testing. We went to the recliner shopping and checked them all out.
Yeah. We have good taste, I think, along those lines.
So. Yeah, mostly.
What is now known as the Hope Lives Foundation has donated hundreds of thousands of dollars. The Boys and Girls Club's Adopt a Child program is one of the recipients. And a few years ago, the two organizations partnered for what has become one of the brightest events in town.
I'm beating cancer!
Glow in the Deep turned into this big night, fun run walk. Whoa! With a concert, a party, and all these things. I was able to have Derek Deke Kroll impact my life from a personal level, and being it that he passed from cancer.
It was an opportunity to do something really cool, partner with a great group for a guy who, went definitely before his time, and has definitely left his mark on many people here in La Crosse in our community.
And funds raised there have helped several more projects, like a scholarship program for college students who have or are facing cancer, and a collaboration with the YMCA to physically help patients bounce back after treatment.
We fund the Livestrong program with all the trainers at the Y. We pay for the 24 sessions of that trainer, and so they can get back at being normal.
And speaking of the Y, thanks to a generous donation, part of the La Crosse Y expansion will include a new home for the Hope Lives Foundation.
We took a $5,000 grant 7 years ago, and through all the people that support us, we've now raised over $400,000 in those years. So it's been fun to watch that happen.
I really thought if we could just get $15,000, we would be able to have such a huge impact on the future of kids' treatment here at Gundersen. And lo and behold, the community is so giving, and our friends and family, and if it were my last night now, I'd be okay with it.
But for all the money and the events and the projects they've done, at the heart of this program is the reason it got started: to be there for those people who are right now facing the fight of their lives. When Garrett Benzing graduated from college in 2014, he was ready to take on the world.
I was kind of at the top of my game, if you will, and cloud nine, and then out of nowhere.
Out of nowhere, an unusual growth on his leg.
And they found a massive tumor. They classified it as stage 3 cancer right away just due to the mass.
For single mom of 2 Robin Henderson, the early signs were admittedly ignored.
I started having blood in my stool in September of 2014, and I thought it was stress related. Nothing could possibly be that wrong.
4 months later, a colonoscopy revealed her devastating diagnosis.
He said, "You have cancer," and I thought to myself, I must be still dreaming. I was in denial immediately, this can't be true. No way.
And for both Robin and Garrett, after the denial came the fear.
Of course you're afraid to die, but knowing how many people you're gonna hurt when you do. Because if I'm gone, I'm in a better place. I don't have to deal with it. They're the ones who gotta pick up the pieces afterwards. And my mom and my parents tell me, "Oh, don't worry about that," but you do.
I had to tell the kids, and kids don't know. Kids think that cancer just means you're gonna die. That's their association, is cancer equals death. So that was their first question, is, are you gonna die? And given the stage 4, I didn't have a good answer. So I just said, no, not if I have anything to do about it. I'm not going to.
But early on in their battles, they were both encouraged to reach out to what was for them an unfamiliar organization called Hope Lives.
I expected what you see on movies for support groups, everybody sit around and sing Kumbaya and, cry and say, oh, life sucks, we're going through all of this. And I called Garrett Giroux, and he's like, it's not like that. We get together and we do fun things and we support each other in so many different ways. Nobody sits around in a circle and, he's like, but if you need a shoulder to cry on, you call one of us who've been through it.
Your family knows your treatment. They know what you're going through better than most. But unless you've been there, you haven't felt those things. You haven't experienced those experiences. And to be able to talk to somebody about that is everything, and that's exactly what Hope Lives does.
One more to be sure.
They have leaned a lot on the group during the past year and have even forged a friendship of their own. And it has all helped get them through what has been a very difficult journey. For Garrett, part of his leg had to be amputated, only to find out a few months later a new growth appeared, meaning more chemo, more radiation, and another surgery.
They literally remove the entire leg from the socket. The one godsend is you can say you did everything you possibly could. I've done everything the doctors have told me, it still came back. What can you do?
And Robin has had radiation, more than a year of on and off chemo, and 3 major surgeries of her own.
There's a lot of days I don't want to go to treatment. There's a lot of days I don't want to be sick anymore. I don't want to do this. And
you call them and you look at them and they've done it. And Garrett Benzing has been my #1 person that I call because I look at him and think if he can do it, I can do it.
Hope Lives doesn't cost its members any money. There's no obligations or attendance requirements. In fact, the only thing Johnny and Garrett have ever asked for.
If we helped you or our group helped you in some way, that you just try to do that for the next person as cancers continue to come up in our community.
The good old pay it forward concept that Robin was recently on the receiving end of.
How you been?
When little Will Nordine was granted a Make-A-Wish during his cancer battle, he wished for a treehouse. Which is where this crew of Hope Lives volunteers came to the rescue.
The UWL wrestling team's all here, Hope Lives Foundation and Friends of Our Foundation.
Those are the main posts right there.
And Will's family knew they wanted to pay it forward.
He's got an amazing family. They have an amazing summer cabin, and they also knew about a young person in our group that just needed a getaway before her surgery.
That young person was Robin Henderson.
we were able to go and just be and just sit, and I may or may not make it through this. And this is what I want to remember.
Tears often accompany the joy Hope Lives provides. And Johnny and Garrett say they're okay with that.
Ultimately, you can't affect what happens due to the medical side of this, meaning the regimen for what the chemo is going to be, the radiation, and all that. And if you can be a part of someone's life, though, and try to positively impact it while they go through this, knowing that you ultimately can't change the outcome, but you can sure try from a standard of love and something that's unmeasured, would you be a part of that person's life? And the answer is always yes.
I wish I never would have lost my leg, I can say that. But I can't ever say I wish I never was diagnosed with cancer. And that sounds crazy to many people probably, but the reason why you appreciate life so much more. And then also, I never would have met all these amazing people.
It's been exactly what you need when you're going through the hardest time in your life.
We're very proud of the things that we've been able to do, no doubt, but it's not just us doing it. We have so many people who have attended dinners, attended the runs, just given us contributions over the years to help further our mission forward. And what we do is really, we're able to put a lens up on kind of our actions for them. And to me, that's just something we do because of what we went through.
Years ago, Garrett Giroux and Johnny Brevik never gave up hope. And because of that, hope lives here, and it lives here, and hope most certainly lives here. In La Crosse with photographers John Schmidt and Greg White, Jennifer Livingston, News 8.